Let's uh, let's switch gears a little and talk about some drugs that exist out there. So, how useful is the antiviral drug remdesivir for treating newly diagnosed COVID-19 patients?
Well, Dennis, I'll start by saying what I said before. All the studies that we've done thus far, all the results we have are in people that have severe COVID that are in the hospital that require oxygen, which only happen to be about 12% of people that get infected. So for the great majority of people that get infected, we still don't have anything. We don't have anything equivalent to a Tamiflu for influenza, a pill you can take that, and that's where we need to go right now because that's the great majority of people. Obviously, the research initially was to try to decrease mortality, and that's when remdesivir and other drugs come in. Remdesivir, I think, has shown clear benefit, but the benefit, I think, at best, Dennis, is modest. It shows a decrease in the time to improvement and maybe a signal of a decrease in mortality. But the reality is the mortality decrease in remdesivir is very minimal. And I think that remdesivir is one component. Like if I have somebody critically ill right now, who comes to the hospital, needs oxygen, remdesivir and dexamethasone are the two drugs that I have available that will optimally manage the patient at this point in time. But that treatment right now of remdesivir plus dexamethasone, I feel like the early years of HIV, we're giving, Bactrim and zidovudine. We're way away from the drugs that we have nowadays, right? It's just the beginning. It's just, they're a little bit of a good job, but they're not doing what we need them to do.
Yeah, I agree, and it's an issue of timing. Each of those drugs probably has a place if you can time it properly. If you can hit the virus at an early stage with remdesivir, that's fine, except you don't know about it. And the same is true
Well, not
for
only that,
dexamethasone.
not only that, Dennis, but remdesivir is IV, right? So even if you have somebody newly diagnosed, but they have mild disease, you're talking about putting an IV and giving them an IV for 5 to 7 days. So the treatments we have right now are really far from optimal from what we need to be.
Yeah, definitely. All right, let's try and look at another aspect.
And again, let me just say one thing in treatment. I really want to challenge you and others who work on drug development, because finding a drug like Tamiflu for influenza, something that we can give orally. I mean, a lot of people we give Tamiflu for influenza is not just because it decreases symptoms. It actually is because it decreases shedding. So if you can take people who had newly diagnosed COVID and who were not sick enough, but give them an oral medication that not only decreases their chance of getting sick, but decreases the viral shedding, you could actually impact transmission. So the treatment as prevention, I think could be applied to COVID if we had those drugs. And I think that's where the next frontier is. How do we find drugs that actually decrease transmission?
And hopefully our EIDD 2801 MK4488 is going to be the first of those really effective oral drugs.
Absolutely. I think that's going to be a really good drug to have.